Welcome to your first year of residency at the Florida Hospital. Before we begin our tour of the hospital, would anyone like to ask me how I received my radiology position here?
So why did you choose to work in the health field?
I chose to pursue my career in the radiology health field because I have been in the health field since I was 17 years old. I feel my purpose in life is to help others live healthy lives. By being a radiologist, I'm able to use medical imaging to scan and diagnose people in a timely fashion.
Academically, what were the first steps that you took to follow your career path?
I started at Valencia College with a major in STEM. With having a GPA no less than a 2.0, I then transferred to UCF in biomedical sciences to receive my bachelor's degree in the sciences. Then proceeding on taking the MCATs and receiving above average scores, I then had to collect multiple letters of recommendation and volunteer where I could.
How was the everyday work environment?
You will spend your time analyzing image results and formulating diagnosis. What is different between radiologists and other physicians is that we are more behind the scenes and less face-to-face interaction. In the hospital atmosphere, you will work long hours, weekends, nights, and even holidays.
What were the steps that you had to take after being accepted into medical school?
After I was accepted into medical school, I then completed a 4-year curriculum, remaining at the top of my class. I had to take the STEP exams, which are United States Medical Licensing Examinations, then applying to a postgraduate program in the radiology field.
How did you relate your personal strengths and values to reaching your goal?
When I was attending Valencia in my SLS class, the professor had us take a personal test on myplan.com. I saw my primary interest areas were investigative and artistic. I then saw my top work values that are recognition, achievement, support, relationships, working conditions, and independence. Knowing that, I did some research in the radiology field and found my interests and values fell right in radiology. After seeing that, I felt a little bit more comfortable about pushing forward.
Financially, how were you able to stay above the cost when you were going to school?
I had to do a lot of research to find out if I was eligible for scholarships and Pell Grants. Using the knowledge from my SLS class, I remembered the Valencia Foundation website and was able to see what scholarships I could apply for to receive my bachelor's degree.
What do we have to look forward to in our residency?
There are several exams, a written and oral-based exam and also a physics exam. With effect from 2014, the system included 2 computer-based exams. All these exams will be done during your regular work tasks.
Is there any steps further after our residency?
You can proceed as a general radiologist, or you can opt to complete a 2-year fellowship in any subspecialties of radiology, like proceeding in neuroradiology.
What are the struggles you had to endure when becoming a radiologist?
A few of the difficulties were staying above in student loans and the amount of years it takes to complete to be a radiologist. In my case, it took 12 years. The amount of work outside of residencies, as reading and studying material, was also a big difficulty to overcome.
Were you able to use some of your other scholarships for medical school?
Knowing medical school would be more expensive, I did some more research and found a list of scholarship providers that recognize passion to heal and want to help achieve those dreams. I found the scholarship in Florida that I was eligible for and applied and received it.
With your primary interest being investigative and artistic, could you tell us how they relate to radiology?
With the investigative value, it applies because you have to take the medical image of your patient and carefully scan, sometimes multiple times, to see if there are any problem areas. For my artistic interest, you need to have an open mind and willing for new things, because in the radiology field, it is always growing.
Are errors common in radiology?
In radiology, you can expect to never make an error. It is possible for you to scan over or glance over your patient's imaging and miss a problem area. It will be pointed out, and what you do from there to fix it is what's crucial, so you do not make the same mistake again.